So happy lunchtime, everyone. I am Kelli Caseman, Executive Director of Think Kids, and I'm happy you joined us today for lunch and learn with Dr. Samuel Workman, a professor of political science and director of the Institute of Policy Research and Public Affairs and the John D. J. Rockefeller School of Policy and Politics at West Virginia University. He has written a new report titled Idea Data in West Virginia, Challenges and Opportunities. We'll talk about it and about IDEA in general. And you're welcome to write questions in the comments or comments in the chat while we have the initial discussion. And then at the end, we'll just open it up and unmute everyone, and you're welcome to share any thoughts or ideas that you have. So we'll go ahead and get started by asking Sam to share a little bit about yourself, what's your area of expertise, where you're from, and how did you wind up doing the work that you currently do?
Thanks, Kelli. I feel like I've already overworked you for a lunchtime just with the titles of my institutions alone. So I'm Sam Workman. I'm a political scientist in the Department of Political Science here at West Virginia University. I'm also the director of the Institute for Policy Research and Public Affairs. Just a short bit about that. We do basic and applied social science in all three sectors, public, private, nonprofit, to address problems sort of important to the state of West Virginia and to the Appalachian region more broadly. I'm originally from West Virginia. You probably could have guessed that by the accent that's over your airwaves right now. I'm from down by the New River Gorge National Park, so have kept my eye. I was gone from the state for 20 years, but kept my eye on things back here and always wanted to come back and see what I could do for the communities here in the state. My PhD is in political science, and I'm a statistician by training from the University of Washington. My first job was at UT Austin, the enemy, as it were. And then I went to the University of Oklahoma, where I worked at the Center for Risk and Crisis Management, and we would do things like model tornado paths with Twitter data and things like this. So an eye on how statistical modeling and social science can work on the ground to make communities better. And I think my own perspective, and many of you may agree, is that one of the central problems in Appalachia, our state specifically, is that our data sets and data systems and data infrastructures are not sort of the quality and up to speed to meet the challenges, the complex challenges that we face in our communities and our state more broadly. And so that's sort of the impetus for my return to West Virginia. It's why I accepted the directorship of this institute, and it's why I'm here with you today.
Great, thanks, Sam. And you and I think you and I started talking, maybe it's been a year now
Sure.
when it started, maybe a little longer. I think it was Dr. Chris Pline, professor of public administration at WVU, who connected me with you. And at the time, we were looking for somebody who could objectively kind of come at the IDEA in West Virginia, meaning, we wanted to know if our state was compliant with federal law and how it was reported. And that comes from years of frustration, fair enough to say, and I would say years of just getting online and trying to find the data and having some real challenges to do that. And for a while, that the data that I was looking for was on the federal website, so the State Department of Education, and that hasn't been updated, I think, since 2018 or 2019. And so, I think that I share that frustration with some of the folks who may be on here, that, that data could be really helpful if used to really try and get an idea of what the problem is, in our special ed classrooms, and ways that we can improve the education the kids with disabilities receive. But the data has to be accessible and available and understandable, which we'll talk about in a little bit. So how about we just talk about the very basics? What is the Individuals with Disabilities in Education Act?
Yeah, so the IDEA data arrives basically by sort of mandate from the Department of Education, and it's tied to state funding, where we record, how it sets out a sort of a slate of standards. We cover all this in the report for how states meet the qualifications for getting a lot of this data and the data they're supposed to report concerning children with disabilities in school systems. And I will say that from my perspective, anyone here working in education, one of the central problems with the IDEA data is that it offers a lot of wiggle room for states to report very boilerplate surface level data and not sort of they have the data, the background data that's much richer, but they only really have to report that top level data and sort of assess how well school systems are meeting federal requirements so that this investment keeps coming to the state. But it records all sorts of stuff, the nature of classroom environments, disciplinary actions, a whole host of things that we'll see a bit in some of the data I'll show you. We'll actually take a look at a spreadsheet full of IDEA data, and you can sort of see where I'm coming from with this. But a whole host of sort of indicators and performance measures for students with disabilities, and sort of whether or not these systems are up to snuff for the federal IDEA legislation. But that's very surface level in terms of what could be understood with this data. Kelli, I think, hits on an important point here. She said she had trouble finding data. I had trouble finding, my team had trouble finding data, even at the federal level. And then the other thing I would offer is this data, you start to find many different forms of it everywhere. And so there's a real lack of consistency in what data is actually available to the public and to folks like me. So.
Thanks. So I think that most of the people who are on this webinar would agree that, IDEA data is really important to kind of as a reflection as to, what we're seeing as the needs and the response to the needs of kids in special education classes. So let's talk a little bit about the data itself. So, well, maybe you could tell us a little bit about the process. So you took on this project, and you alluded to it a bit when you said you had a hard time finding the data. Yep. What was your process in kind of looking at the act itself and then looking at the data and coming to that conclusion as to whether or not our state was appropriately reporting?
Well, so my first sort of stab at this was one of my staff members who's actually on this call. I sort of told her to start poking around. The first thing we wanted to understand was sort of where West Virginia stood vis-a-vis the federal mandates and for funding reasons, because it's an important thing. If you're not up to snuff, then the federal government weighs in more, and of course questions of resources come into play and all this sort of stuff. So my staff looked into this and sort of ascertained that West Virginia was in compliance or very close. They actually received their final letter that they were in compliance this past summer. Those weren't released till I think early August doing this. And so that was the sort of legal approach to understanding where we were as a state, was sort of the first step. The second step was sort of basically scraping as much data from the state and federal websites as possible, and for surrounding states as well, so we could kind of see how other states delivered the data. And it became a challenge because there are spatial variations in how the data is presented to the public, not just across states, but even within our state over time. Kelli mentions how some of the data sort of ends. It actually ends in 2017 and is collected sporadically even before that. And so we got as much data as we could, and then we sort of went through it and tried to make sense of it. And one of the key things that's important when you're thinking about data organization is to think about how people are going to use it. And of course, if you've looked at even the summary of the report, sort of the boilerplate is it's not organized to be usable to anyone other than the Department of Education, who is assessing the reporting requirements. So Where we ended with this first report is sort of talking about what needs to happen to the data to make it useful. And we are now working on a way forward to try to at least illustrate what we can with the data, spatially and temporally, to show what is possible when the data is organized for use, not just by the general public, but to expert communities like Think Kids, WVDDC, and a host of other folks interested in these problems.
Yeah, I want to use an analogy, and I think it's something we'll probably talk about in a minute, about the difference between useful data and proving accountability. And so a couple of, I think it was last year, I was working on a project with the State Tobacco Task Force, and we asked the Tobacco Quit Line to share their data on, how many people utilize the Tobacco Quit Line, how many people wound up quitting, how many people went on NRTs, just kind of some basic information. And they sent us back a 700-page Excel spreadsheet. And they said, well, here's our data. And it was clear to me that they saw us asking for it as a means of saying, we want to see that you do things, right? Like, we want to see that you're working. But I have, that is of no use to me. I showed them in response how other states reported that data, which was just like one page. Here's how many people called us. Here's how many people followed through. That's just what I'm looking for. It's not my job to really kind of decide whether or not they're fulfilling the contract they have with the state. That's of no use to me. So when we talk about IDEA data, I want to look at it and see, of the 13 disabilities that are covered by IDEA, I want to see if there's a rise in any of them over the years. I want to see, particularly now, since we're in such, I think it's fair to call it a crisis on special education programs around the state. Do we see more kids leaving the special ed programs? And if so, why? What do our graduation rates look like? Those are just very specific numbers that I'm looking for that I can't get to when I look in those spreadsheets. So I guess my question to you, and this is probably a lot longer than you probably have time for, but how do we get from point A to that kind of data that we are really looking for to point B, where the people who hold the data are holding on to massively large spreadsheets that we have no idea what to do with?
Yeah, so this might be a good time for me to run through the presentation and give you some concrete examples of what we're talking about when we talk about usability of data and how to think about that and how to arrive at it in a place that's sort of meaningful for everyone. So do I have the power to share screen here?
You do.
Okay. Let me share this. Can folks see this?
Still coming up. There it is.
So we can see this now, everyone? Yeah. Okay. So this is an abbreviated, in an effort to sort of raise visibility about this. This is an abbreviated slide deck of a presentation I gave at the University of Colorado, Denver, a few weeks ago about this data and using it as illustrative of the typical problems we find with administrative sorts of data. And I just want to acknowledge that Think Kids and West Virginia Developmental Disabilities Council have been great partners in sort of seeking out sort of solutions to some of our tough problems with regard to this. So I work at the intersection of the academy and sort of public affairs functions. And so one of the key things that I do when I approach any data right from the get is think about how the folks who should be using the data are going to process that information and what is amenable to aiding them in doing that. And one thing that I would say is that, when we think about things like IDEA data, we're thinking about, parents, communities, we're thinking about researchers and expert communities like Kelli's or mine. But we're also talking about legislatures, right? State legislatures have a need to sort of understand what's going on over time and across space with regard to this stuff. What I'm about to give you is sort of an opinion opinionated view of data and its uses. And I want to think conceptually about this and sort of break it down in sort of how do we approach getting this data to a format where it's usable. And in doing this, we're going to talk a lot about organization and how that's different than curation of data. So there's a huge sort of question motivating this, right? It assumes we have data and we have some data, some idea data. We don't have all the idea data, and the data we have is not in the best form. So we think about data in the academy as coming from systematic, and that's key there, systematic observation and recording. And one of the key problems with idea data is it is collected, but it is not systematically recorded. And I'm going to show you some examples of some of this stuff at the end of this. The other thing is thinking about what data is. And I always ask my classes when I teach this, is an average data, is a percentage data? Well, the answer is no. Data is what that average or percentage was calculated, is what was used to calculate those things. And so there's a big difference in people's minds. A lot of the idea data is delivered as calculations and not as systematic observation and recording. And what that means is that it becomes extremely unusable in research, professional, and expert communities. And of course, we have to think about the ways why data is collected. And so data comes from, everyone thinks natural, biological, physical systems. I will just emphasize that the built environment, we talk a lot about that in healthcare. It is so important in the educational systems as well. The built environment influences how we live, how we learn, all of these things. And we live in the age of the Anthropocene, which means human systems that we erect structure all of this stuff. One of my favorite examples ever of how, data is of more and less use. I always talk about bug health. So how do you know if a bug's healthy? Well, you don't really. You just know if it's alive or dead, pretty much, right? So we have to think about how we're recording things in all of this. And this really gets to points both Kelli and I were making earlier. Democracies, and this is not necessarily a bad thing, but we have to be aware that democracies tend to foster lookup data infrastructures out of a concern for accountability. Now, what does that mean? It means a value orientation. So most administrative data that you're going to find, especially at the state and local level, is built with the notion that the government is accountable to the public in the back of their minds. And that might seem like a great thing, but the problem is those things are usually built and distilled to satisfy reporting requirements. And so when many state data systems release data, they're thinking someone will want to know the value of X, Y, or Z. That is a wholly different question than trying to tackle societal problems where we want data sets to be built for integration and comparison, to be able to recognize patterns in data. And so our systems born of this sort of democratic accountability, and in this case with the idea data, accountability to the Department of Ed, federal level, it's really built just to show the values of things for particular states or educational systems. And what normally happens is these will be delivered to the public and the rest of us as spreadsheets. The problem is spreadsheets are really suboptimal for everyone except folks like might be on this call, right? They're not great for the public, and the public are not exposed to spreadsheets very much. And even in classrooms here at WVU, folks can tell you that as astute as our young folks are with mobile devices and all this, they don't really understand spreadsheets, even young folks. So that's where we are. What happens then, what we can see with the delivery of a lot of this idea data is it's sub-optimized for delivery to both the public and to expert communities, because it's oriented towards these sort of accountability questions, and it creates myriad problems with the data. So that's the problem. How do we begin to think about data systems and what sort of raises the quality of data systems? And I want to think about two things: organization of data and curation of data. Organization of data has to do with how data is actually structured in a spreadsheet. And unlike curation, the organization of data is objective. No matter what type of data we're talking about, that's it. There's a set of principles that sort of guide how it should look like. Data curation is different. It's problem oriented and intentional. So when we want to connect idea data to things like EPA data on water quality or public health data on the opioid epidemic or something like that, the data has to be structured to allow those sort of integrations and analysis. So, just boilerplate recommendations, the organization of the idea data is very problematic. And at a minimum, data has to be organized, because curation, that is orienting it towards understanding societal or substantive problems, depends first on it being organized correctly in spreadsheets. So these, in some ways, these problems are the gifts that keep on giving. And that's important because all research, and we could replace research with questions, are really comparisons across time and space. And so our key units are going to be spatial or temporal units. Now, there's a lot of temporal sort of unit thinking in some of the idea data, much less spatial orientation to the data. But we should always be orienting data to these keys. And we always want to think, if we had the data, what would we want to show with the data? That's the key question there. So some very simple takeaways, and I'll wrap up and show you some of this data, is that West Virginia's idea data is not optimized for the public or expert communities. It's really just optimized for meeting reporting requirements. Greater emphasis should be placed on organization to exploit temporal and spatial patterns within the idea data itself, without talking about other data sets that might be important. That would then allow curation so that it can be integrated with, myriad data sets we have on societal issues here and elsewhere at the state and federal level, to better understand problems around disabilities in our educational systems. And the other thing, and this is actually a big one, is it should be attentive to the role of intersectionality to better understand children with disabilities and the environments in which they're learning. So that is in general sort of the roadmap for arriving at data that is usable for most of us. You can get in touch with us at any of these sort of avenues, but I want to share a screen here and show you what I'm talking about. And this will actually speak to some of Kelly's comments earlier. Let's do this one. So if we can take a look at this, up until 2017, this is how the data was reported. Now, this sort of organization, just in general, what the data looks like, is starting to move towards what a social scientist like myself would recognize as at least headed in the general direction of quality data. But what do you think would happen if we showed parents this spreadsheet? I don't think it would be enormously helpful, right? And even for academics like me, things like this, you see these headings up here? They wreak havoc on our ability to sort of process data in standard modern statistical programs. And so even with the data that we had in 2017, there are issues with it. You also have some vague recording here of the data. So less than or equal to 2. So some kind of inexact numbers until we get up to, 4 or 5 or 3 children experiencing these things. And that was what we had in 2017. If we want to look at data now, let me stop this for a minute and share one more. So here, if we look at section 618 data, and that's really like a lot of the IDEA legislation is centered on section 618. That's where we talk about calls for reporting of various things. And so what we have here is a set of tables ostensibly constructed in order so that the public can understand better systematic variation by all sorts of categories of these things for children. So what's so wrong with this? Well, when we take a look at it, so I guess what I should first say about this, by the way, this type of delivery completely useless for someone like me, because there's no way to arrive at the original raw data that led to these tables. It exists, but it's not available to us, at least not currently. So what do we do about these? In terms of experts, all of this sort of stuff like calculations of percentages, of totals, all of the coloring in the background, these long header names, and the lack of raw data, the lack of any spatial context, because remember, we're not talking about counties here. These are state totals, right? So we can't see spatial patterns. It's important, as Kelli noted, to know whether these things are increasing as a problem, decreasing, stable, whatever. But it's also important to know where, right? So are there certain areas in the states, like the coal fields or the panhandles or someplace like this, that are experiencing more of these outcomes for children? As a method of delivery for the public, again, the public simply does not understand spreadsheets by and large, even younger folks. So, and then you run into problems where folks won't know that there's a data dictionary that goes with these things. And so then what do these stars mean? Do they mean nothing? Do they mean, because the thing is, missing data is different than non-existent data. And so how do we tell what's what in here? And there's a real big one here. So I mentioned intersectionality in my slides. One of the things that really struck my team as we're looking at this is, so if a parent pulls this up, for instance, and even if they have facility to look at a spreadsheet, it's very rare. I mean, people don't think of their children as, well, my child is African American. No, their children are an African American girl of a certain age, right? In a certain location at a certain time. And so this provides no context for that. It sort of whitewashes the sort of intermix of things that are, I can tell you, especially in public health data and a lot of policy systems, are really important for aiding people to understand exactly trends for children like their own, for instance. It's important to researchers because we use this to understand sort of societal uplift and all other stuff. But just for a parent, right, your child is never one of these things. There's some combination of these things. And currently in the data, there's not a lot of facility for understanding that. So I'm going to leave it there for now. What we are doing is sort of using some of the older data and looking at some of this data to the extent possible to try to illustrate the sorts of patterns over time and space that would be useful to understand, and then explore what it would mean to connect this data to other important things in a way that would help us better understand, how these children are faring and sort of policy solutions to much of what they face. So I'm going to leave it there and turn it back over to Kelli to sort of organize things for us.
Well, I'm going to share my 2 cents and then ask you if there are any recommendations that you want to share directly from the report, and then open the floor and see if anybody has any questions. And so When I first contacted you, it was after a conversation with Christy over the fact that, sometimes it almost felt like gaslighting over the years when you would try and get the data and you couldn't find it on a website. And then, I would get a response that said, well, what do you need it for? And then I would get the data, and then I would try and piece it together, because essentially what I was trying to figure out was, do we have more kids qualifying for special education? And if so, what were the disability uh, identifying one of the 13? Are we seeing something trending up? And then, this was, I was hearing anecdotally from a number of school staffers that, we're now seeing kids from the kind of first wave of the opioid crisis in schools, and we're seeing more of an acute need for services. Well, so that's something I would definitely be willing to advocate for more funding to ensure that these kids get a quality education. But how do you quantify that when you have no data? You just have staffers who are saying this. At the same time, we're in a place in West Virginia where school enrollment is going down. We have fewer young people who have children living in the state. So we have a school aid formula that is putting fewer dollars into our schools, and we have a real concern that fewer dollars are going to go into special education. Then we've seen some things unfold. We've certainly seen escalated cases of abuse that are costing the county school systems even more. It had always been our hope that through litigation, it would kind of force county school systems to be more mindful, create strategies to have a more conducive learning environment for children in special education. It's not feeling like that's the case. But to me, it has always been, if we're going to go down this rabbit hole, we have to start with good data. And IDEA seems to have some fundamental data that they're required to report anyway, that can really get us to a place of a better understanding of what's happening in our special education classes. So to me, it's paramount that we at least get somewhere to where we can get data that can help shed a light on the way we can go to ensure that all kids are getting a quality education and families feel safe sending their kids to school. And it seems as if we have a legislature that agrees with this. But when you have no data to make informed decisions, you wind up with more and more cameras in schools, which are important, don't get me wrong, but there's no strategy to really get to where we need to go. And I'm afraid we'll just continue down a path of escalated litigation. We saw fewer aides in our special education class because many of them went on to become these reading aides thanks to other legislation. We weren't prepared for that to happen. And so it seems as if we now have fewer qualified staffers in these special education classes, knowing that this is also a crisis to begin with. And I know that a number of families we work with feel as if it's not as if they're not heard, but they feel as if they're coming at this with an emotional response rather than a strategy. But you can't have a strategy if you don't have the data to really make an informed decision and to plot that path. And so, having said all that, that's really how we wound up with this first report. I'm very eager to hear about the second report, but let's talk about that in a minute. Do you want to discuss the recommendations of what you would see?
Yeah, absolutely. And so what really spurred some of the first conversations we had about this when Kelli approached me was sort of how this does connect to other ongoing things in the state, and sort of what leverage can we have on it with that. In the spirit of sort of the framework I laid out in the presentation, what we would recommend just at base level for parents, teachers, other folks in the community, folks who are going to access the data through WVD's webpage, is to have a set of embedded dashboards accessible through a browser. Right there on the web page, and parents could get on there and click through and and sort of really narrow down what they want to understand about the data. And that wouldn't be too difficult with the raw data that is the background for much of these spreadsheets that they already release anyway. They have to have that data or they couldn't compile the spreadsheets we do have. Now, the reason I think dashboards are, and clickable ones are good in comparison to spreadsheets is citizens understand them a lot better. They even use them when they pay their property taxes at the county level, for instance. So they know how to click down a menu, right? The other part of this, and the thing I've not mentioned yet, is that Excel costs money. So if you don't have it, you have to own a copy to get through it, or you have to know workarounds to get to sort of open office and this sort of stuff. Now, for the public, I think that's great and would solve myriad problems. For researchers, really, you're looking at taking the spreadsheets by the horns and making them compatible with sort of general practices in the social sciences. And what I would advocate for is delivering them as a packaged R package that can be accessed via the web and then pulled in with other data sets and integrated that way. So that, you know, someone in public health or someone working on environmental policy or someone working, you know, elsewhere on expenditure policy or something like that can immediately pull the data and then put it to work, combine it with other things. It's very difficult to do, though, unless the data is organized well and it carries both temporal and spatial identifiers. So one of the things to think about for delivering the set of sort of spreadsheets that we do have is, for a researcher, there's no need at all to have 20 spreadsheets, one for each year. They can all be in the same spreadsheet, organized well, so that we pull them down and get to it really quickly.
That's great. So essentially what you're saying, and then I want to ask two questions, one in the chat and then one somebody had sent to us, is and don't let me put words in your mouth. The way the data is now shared is kind of straddled. So it's in a way that's not particularly useful for the general public, and it's not useful for the experts. So it needs to be shared in two different ways. One that, and you just gave those recommendations. One is a dashboard, and Nicole asks, isn't that data dashboard already available with West Virginia Zoom data?
So what I'm recommending is it be housed on WVDE's website. So because on the website, they have the spreadsheet data, and right above it, they have this data dictionary. And I'll actually give WVDE some credit here. Most state offices do not do a very good job of data dictionaries and sort of helping folks understand what it is they're seeing. They actually have a really good one right above there. So when they get on there, let's take a look at this one. Someone puts it in here. See what they have. Click through.
So Joseph shared, these data are highly biased by the fact that the schools are denying diagnoses and blocking eligibility at eligibility committee meetings. So thank you for that, Joseph. And that opens a whole other topic that I think is super important, and that would, as we walk down this path, be important to discuss. So, you know, the denying of diagnoses is something that I think is very important to discuss. Certainly when we started this project, I had people tell me that there were concerns of people, of students not being tested, that there was a concern of the cost for the county school system to have too many children in special education. I think that there are so many conversations that will come from us working on this project.
Yeah, so in regards to the link doesn't work. And for a normal person, so when I go to WVDE's office, I know to go and say, well, what's for researchers' data and whatnot. No parent is going to realize this. So that's the importance of sort of embedding it right there where you have the data, because they're going to go to the Office of Special Programs and all this sort of stuff, special education programs. Secondly, with regard to this bias, that is absolutely correct. And I will just tell you now that allowing the data, curating it in a way that it is linkable to other data from, say, the CDC, from US Department of Ed, to other states, all of this sort of stuff would allow us to get a handle on estimating what that possible bias could be by basically correlating with a bunch of other measures of things. As the data stands right now, that's not really possible. So so what I would say is, yes, I agree, and the way forward with that, at least getting a guess at whether there could be bias and what magnitude of it is, would be allowing this sort of integration with other things. So
I agree. To Nicole's point, I think that I would love to see, as part of the dashboard on Zoom, on Department of Education site, where you can see the years of information from data. So how many kids, say, 10 years ago in a county were in special ed classes as to now, and then what those different diagnoses are. I think that would be really important, is seeing, just even on a community level, sharing that on a community level with stakeholders would be really important, so they could really customize the needs of their community.
yeah, and I'll say something else about that too. When you look at the way the data is recorded, so when we're trying to convey information, it's sort of it's knee-jerk sometimes to want to give them some way to compare. One of the ways we do that, you see in the idea data fairly often, is calculating percentages and whatnot. But percentages are only meaningful when we know what the baseline from which they're calculated. So 10% of 100 is very different than 10% of 1,000, right? So we don't really know like what the prevalence of some of these problems are from that sort of data. So I would echo Kelly in saying, I think some very simple, graphical functions, just a line. Does it get up or down, right? And I think the other one, the thing that strikes me is one thing that people, the general public understands intuitively, immediately, as soon as they look at it, are maps. And so right now, the state, we're not really afforded a way to understand spatial patterns in the data. So where if this is occurring, if it's increasing or if it's decreasing, where is that happening? And then can we think of reasons why, and sort of how we might think about it and problem solve around those issues in context, because without the sort of spatial information, context becomes very difficult.
Agreed. Thank you. Before I want to talk about your second report, but before then, I want to welcome the opportunity. Anybody can unmute. They have anything that they want to ask or any comments they'd like to make? Hey, Christy.
I would have a comment. So just a couple of things. First, to the dashboard. 10 years ago, you could actually navigate that dashboard a little while. And, in my work, it is the data I'm for advocacy. I'm looking for it. I'm looking at it. But the Department of Ed changes this dashboard like almost yearly, to where I was on there just, right before this session started. And it has changed since last year in being able to find it. Like one of the things that you, to, I guess, even Mr. Scotty's point about, the way that, I guess people at the school system diagnoses, or how they, that's not the right word, but anyhow, so how they determine eligibility, which category. one of the things that we were trying to look at, I think, Kelly, when I was talking to you about this in the beginning, was we know that students of color are often misdiagnosed. You can't find that on this Zoom now, and we think that we know that they have, are often deemed behaviors,
Right.
or a behavior problem or a behavior disorder, and they later find out that the child has autism. You can't find this data now. We actually, when we started looking at it, it was there and then it was gone. And then even, I think last year, there was data that was on that dashboard, and then suddenly it disappeared. But then it came back and you can find the data, but thankfully I print things off, but it has never been easy to navigate. It seems like once I learned to navigate that website and find the data, it changes. And I mean, I'm sure that's not purposeful, but this is an issue. And it is, it would be beneficial to parents like myself, advocates like myself, legislators, and the school systems themselves to be able to compare this data and look at these trends. So thank you, Dr. Workman, and thank you, Kelly, for all your work on this project. But that's my 2 cents.
Yeah,
Thank you.
no, go ahead, Kelly.
Thank you, Chrissy. I want to first reiterate what Chrissy said, because she and I have had these conversations over the years, and this has always been kind of a challenge of where do you find it on the website and how is it listed. And Jonathan Shank has shared a link to where you can find that information now, and I appreciate that, and I will put it in the notes that we share, plus the link when this is uploaded to YouTube, so you can share it with others. I just want to say that, what I'm hoping we're articulating by this is we're trying to find ways to make the information as accessible as we can to the general public, so we can use that data to meaningfully make positive change for kids in special education. And then there's so that's what we mean for what's being reported online. And then there's that whole other recommendation that Sam is making of how to make that data available to researchers. And I think, Sam and I have an op-ed that will be coming out next week where, if we could get, we have a great research university at WVU, we have researchers at Marshall, and we have nonprofits like Think Kids and others in the state that would love to do more work on this issue. We want to do more for kids with disabilities in the state, but it's really hard when you don't have data. It's very hard to draw down philanthropic funding when you don't have data to make that path forward. And so I think these recommendations are really key starting point to where we can go with this. I see that Ashley has put a question in the chat. I agree, Christy, it should be easy to find. Have you found an example of either another state's Department of Ed or a similar organization that is using systems like what you are proposing in West Virginia?
Yes. So let me answer a few questions. So number one, again, thanks to Jonathan for putting that information in there. We also include links and access to all this at the state and federal level in the report as well. In terms of sort of the 618 data, that's what I was showing you in the website when I was talking about on the share when I was talking about intersectionality and whatnot. As for Ashley's question, yes, there are other states who do a much better job reporting this data than us. Michigan, for instance, does an incredible job of doing it. So I'll say this too. This was interesting as I was listening to folks talk. So when I'll give you, for instance, when I click on the website for the dashboard, I'm taken to a page telling me it represents a massive security risk to WVU systems. So I don't know what's going on there, one state agency to another. But these are the types of problems we sort of run into. And, I think that a lot of this data, so mind the name, Jenny, who is a member of the West Virginia Behavioral Health Planning Council, that's exactly the sort of organization I'm thinking about when I'm arguing that this data should be a bit easier to combine with other forms of data that are out there, especially data on public health and other school systems. I can say that West Virginia is not alone in this. A lot of our neighbors have some of the same pitfalls in providing the data. And I would also say that this is not, so whenever we think about sort of how administrative systems deliver data, this isn't a WVDE problem. This is most administrative systems, okay? So if you want, in West Virginia, if you want a real sort of tour de force on the best way to deliver data, the state auditor's office is your best. They do an exceptional job of delivering spending data. And that sort of orientation is something we should be moving towards in a lot of these different issue areas. So in terms of connecting this with what other folks are doing around the state and whatnot, that's sort of what we're doing with this next report. We're at least going to be able to begin to get some temporal analyses of some of these things and facility for mapping, at least holistically, sort of what we're doing. I would also add that someone brought up a good point of diversity in communities, and with small sample sizes, that's an issue. I think what we should all understand is that I'm not advocating, nor is WVU advocating for the release of all of these raw figures to the public. At universities where we have experts working on these things, we have protocols for all of this that are tied to IRB, federal regulations, and all of this. And so really what we should move towards is a system where researchers working in these areas who are cleared by IRB boards and whatnot can have access to some of this data and who understand how to present it in a way that's sort of non-threatening to those vulnerable communities from which they come. So there are processes in place for this, at least on the expert community side. For dashboards, it's a very simple matter of organizing the data such that it's understandable and easy to compile for parents and other community members.
Paul, do you have a question?
Yeah, hey, thanks for this, Sam. It's great to see you. Thanks
You as
for
well.
hosting. Also, Kelly, I mean, sort of a question, sort of a comment. I mean, I've done some work in and around state education agencies all over the country. You were asking about the comparisons to other states. And this is like evergreen. This is not just special ed. It's not just West Virginia. And really, in a lot of ways, a lot of these comments today, to me, I keep, we should do this, we could do that. It's a matter of political will, right? This requires politicians to spend money to make state education agencies better. And no legislatures want to do that, right? No state legislator ever lost an election because they underinvested in the data shop in the West Virginia Department of Ed. So like, unfortunately, that's just a massive hurdle here. And in some ways, some of the best practices almost really are in like local high performing school districts that know how to like make really great dashboards and really great models. And it's almost like maybe we have better luck if we find those and then try to like migrate them up, to the state, rather than relying on the state to, turn this battleship around, because it's such a big task. And a lot of the political incentives are just so lined up against it. So just an observation, really, I'd love to hear your reactions, because that's what I see, when I talk to people around places that do this kind of work.
I think so. Paul is cut from the same cloth as me in many ways. I think for at least in West Virginia's instance, I think where you do have some political leverage is when these things sort of reach a fever pitch problem. And that's kind of where the state is right now. This is getting attention. Issues around this are getting attention even right now in our interims and things. And I think legislators want to know what to do, but frankly don't know what to do because we're just a little too used to meeting sort of our federal obligations and not thinking about how other folks in the state are going to use this data. But I mean, I would wholeheartedly agree with everything you said, Paul, and I've run into it, not just in education, it's every walk of data life, basically at the state level. So
I completely agree. And I think that there is a will to at least listen. Christy, I'd love to hear your thoughts on that as well. I think that we have legislators who are saying something needs to be done. What should we do? Our response is look at the data, use the data for data-driven policymaking. But I think that we need more of a critical mass saying it rather than just a couple of people. And I think that we need to find better collaboration with the system itself. I mean, if we tried to go to the legislature and say, we need a better data system, and the State Department of Ed said our data system is just fine, then we would be, it would make it much more challenging.
And I'll go ahead and give my thoughts. I think you're right, Kelly. And that is what I'm hearing from the legislature right now. They are asking, or at least I'm getting calls. Gosh, I got a call last weekend, even before the interim started, because it is such a mess that they do want to know how to help. Which is great, that I've been chipping away on this for almost 20 years now. And so I'm glad that we finally do have an ear. And this is one of the issues. So if we can, make things better for our, I get as many calls now from teachers as I do parents. And now legislators as well. So if we can fix the data system and education, that would be great. But I think that everybody's desperate. It's gotten so bad. And it's a weekly thing to get these abuse stories that finally somebody wants to fix it, or at least attempt to fix it. I don't know that it can be fixed, but we know that we can make it better. So.
Thanks, Christy. Well said. I see we're at the top of the hour. Does anyone else have any more comments or questions? I see Tamara. Oh, this is Special Ed Director at conferencing with our data team. Your presentation has been interesting. There's definitely work to be done, but as Nicole mentioned, providing raw data may result in FERPA violations due to small sizes. If you'd like to collaborate to access some of this data you have been able to find, you can submit a data request, as Jonathan linked. State Department of Ed is not contacted to our knowledge and may have been able to add meaningful contributions to your study. Maybe your next research project, you would suggest reaching out to the State Department of Education to collaborate.
Happy to do so. And I think in the next project, just thinking about what data is there and what we see is one thing. The next project actually where we want to understand these trends across time and space and linking it, that's where the real sort of rubber meets the road on understanding sort of the larger problems around this stuff.
Well, great. So thank you so much for your work on this, Sam. This is really important, and I hope that we can come together to the table to discuss it further in good faith. And I appreciate everyone who joined us today. This will be available on YouTube, and onward we go. You'll get more information about this project as it unfolds. So thanks again, and have a good day, everyone.